Good morning, everyone, and thank you again for sticking with us here on KXAN Live. I'm Will Dupree. Here right now is the Austin Public Health briefing for COVID-19, its impact on our community, and the ongoing vaccination process, where they'll likely discuss the Johnson & Johnson vaccine being paused, not only in the U.S., but also here in the Austin area. They'll also discuss possibly moving to stage 2 guidelines for the risk-based initiatives that were put out there by the community. So let's listen in as this briefing begins from Austin Public Health.
Questions on behalf of the media. Stephanie, over to you.
Good morning. We are so excited about our partnerships. Our mobile team is going to be providing vaccines today to our musicians. We're excited to be working with the Health Alliance for Musicians, HAM, and really excited about that partnership. That is what's going to be so important for us as we pivot our operations to pick up more partnerships, working with grassroots organizations, working and meeting people where they are to provide the vaccines. As we continue to plan and shift our operations, we're going to start going into the neighborhood more, working in apartment complexes, being in community centers, and changing our hours of operation. We must be flexible. Our goal is to provide vaccines to our community and meet them where they are. At this time, I will transition to Dr. Escott.
Good morning, and we're certainly excited about the availability of vaccine increasing across our community. But COVID is still here, and it's still spreading. Unfortunately, we are seeing an increase in cases with a 25% increase in the moving average of new cases over the past week. We're seeing an increase in hospitalizations locally with a 10% increase so far as compared to last week in terms of individuals hospitalized. So we've got to maintain those protections so that we can drive down disease and allow the opportunity for people to be vaccinated. We have recently renewed and revised the health authority orders, which are in effect through May 18th, which continue to require masking and protections in public places so that we can continue to drive down disease and get more people vaccinated. With that, I will turn it over to Janet Pichette.
Good morning, everyone. I just wanted to kind of echo what Dr. Escott had to say, and that was while we are seeing increases in cases, new cases occurring, our rate has been relatively flat, but it's been oscillating over time, and we want to keep it down and keep transmission risk low. This is a good reminder as people are getting vaccine on board and becoming vaccinated, and our transmission risk in those individuals who are vaccinated becomes lower, the transmission risk in children and young adults still remains high. So we have been seeing school clusters mainly associated with athletics, school athletics, and other activities. And we just want to make sure that people continue to use those prevention measures that keep you safe and keep others safe, and that's masking and social distancing, staying home if you're ill. Again, we don't want to see a departure from a very flat state up to a high level again, like we're starting to see in some other U.S. states in the Northeast and whatnot. We want to make sure that we stay at a relatively low and flat rate, but we are concerned about some of these oscillating numbers that are showing increases in our community. And with that, I'll turn it over to Cassie DeLeon.
Thank you, Janet, and good morning. We are looking at how vaccine demand is changing. As Stephanie mentioned, some of the strategies that we are taking out to the community to try to ensure that there is vaccine available in every space that someone would go seeking vaccine. In addition to that, we encourage anyone who is in need of vaccine to contact 311 so that we can assist you in finding a vaccine location, in registering in our system, and scheduling that first dose appointment. If you are in need of your second dose vaccine and you receive the Moderna vaccine, Austin Public Health can provide that second dose, regardless of the location that you received it or provider. So if you are in need of that vaccine, please contact 311 as well. We will make sure that you have information about what clinics are available to you to receive a vaccine, and we'll give you instructions on what the next steps are for getting those vaccines. Again, we want everyone to get vaccine, get it as quickly as you can. There's lots of vaccine options, and if you choose not to use Austin Public Health, please seek a provider that is providing vaccines so that you can get fully vaccinated and protect yourself and protect your family and protect our community. And with that, I'll open us up for questions.
Thank you, Cassie. Now to our pool reporter, Tori Larnd with KView. Tori?
Hi, good morning, everybody. Happy to be here on behalf of all the reporters. So I'll start off with a question from us, KView. APH posted last night and multiple nights there was nobody waiting to get into the portal, yet thousands of appointments are available. Has vaccine supply met the demand in Travis County?
We definitely are constantly assessing the vaccine supply and ensuring that there are multiple opportunities for individuals to get vaccine. And that, again, is kind of referencing back to what Stephanie mentioned, that we are trying to ensure that we reach people where they're at. We give people multiple opportunities. And we realize that a vaccine appointment is important to have to get the vaccine to plan for the clinic. But also we want to make sure that the appointment process is flexible enough that it allows people to plan for their work and for their own personal schedules. And so we are working on strategies to ensure that there are very limited barriers to anyone getting vaccine. And so we hope that this is an opportunity for folks to really start, if they had been discouraged because they had difficulty finding vaccine, that we're at a point where folks have a lot more ease of getting vaccine. And again, there are a lot of tools and resources to help folks find vaccine. So if you're in need of vaccine, please contact 311. We're still at a point where we are seeing quite a few that are still needing vaccine. And we're, again, are looking to identify additional strategies to reach out to those who just haven't been able to get one yet.
And I'll add on to that. This is certainly what we anticipated was going to be the progression of vaccine supply and administration for us across Texas and across the country. We were going to have a period where demand far exceeds supply, and then we're going to have a period where vaccine supply and demand are, in steady state. So we plateau out, and then we're going to go into a phase where vaccine supply exceeds demand. And this is what we've been talking about again, about shifting strategies, changing hours, changing locations, so that we can make it easier for folks to get the vaccine close to home. Of course, APH is one of 350 providers across Travis County. So this is a community-wide effort. It's not just APH or community care or the city or county. And we're pleased to see that more vaccine is available across our community. So this does provide us an opportunity as Austin Public Health to transition back to our safety net status, to start to focus more efforts on those individuals that don't have the access that other people do in our community, so that we can provide those services to the folks who need it the most.
Okay, this next one is from Community Impact. Will APH consider leaving the vaccine registration portal open around the clock rather than only opening it during limited windows, now that appointments are being consistently left unfilled during those windows?
Yes, we are looking at strategies to help alleviate the scheduling process so that folks can just schedule when they are thinking about getting a vaccine, that they just go online and get scheduled. we are currently looking at how that could roll out and anticipate providing information about that in the near future.
KXAN, they asked, do you have any concerns about the rebound of visitors to Austin, especially as Governor Greg Abbott has signaled that Texas is 100% open for business? Has there been any difficulty enforcing health guidelines with tourists?
I'm happy to take that one. Certainly we're concerned about things being open 100%, but we're pleased to be able to continue the mask mandate locally, to continue the other recommendations for businesses and other public places, which is going to mitigate that risk of being 100% open. I think the businesses in our community, by and large, understand the role they play in controlling risk. I think our businesses understand that if too much risk happens and we surge again, that may impact their businesses in a more profound way than adopting those protections right now. So I'm pleased with what our business community is doing to respond to the rules which are in place, and I think that's going to continue to protect Austin. Our hope is that any visitors to Austin recognize what the local requirements are, what the local laws are, and they will abide by those laws.
This one's from the Austin American-Statesman. What's the percentage of people who never showed up to receive their second shot through Austin Public Health and the Circuit of the America efforts?
We are having a pretty good uptake of our second dose, and I can't recite that exact percentage for Austin Public Health or Circuit of Americas at this time. However, we are seeing quite a few folks who are still coming back for their second dose. I will mention anecdotally that we see at our second dose clinics about a 10 to 20% no-show rate. That doesn't mean that they did not come back for their second dose from Austin Public Health. They may have gotten their second dose at a different clinic from Austin Public Health, or they're choosing to delay and get their second dose on another day. However, we also know that some individuals are getting second doses from other providers, and that's completely fine. We want to make sure that individuals are vigilant about getting that second dose and noting that you attempt to get it within that 28 to 42 day window if it's Moderna. If it's a Pfizer patient, a patient that's received the Pfizer vaccine, that you get that vaccine within the 21 days after you had your initial dose, and you go to a provider that is providing the Pfizer vaccine. And so we really want to encourage folks to make sure you follow up on that second dose. It's really important to be fully vaccinated. And if you are having any difficulty or struggling to find a location to get your second dose, please contact 311, and we can definitely assist you in trying to connect you to a provider.
I'd also like to add that we have, with our system, we've implemented a process where the system will send an email out or a text message to alert you, that you missed your appointment, and our staff will reschedule you. So we have a process to be able to reschedule folks. In addition to rescheduling individuals, you also have the ability to go into your system and make a note to let us know that you did receive that vaccine from another provider. And so what that does is that alerts us that you no longer need that second vaccine from public health, and we are able to redistribute that vaccine to another individual. As Cassie stated earlier, the importance of us being able to be flexible with all of the rest of the providers to provide a second dose vaccine to anyone that's received the Moderna. So it's important for the public to understand that they can come to us for their second dose, even if they received it from somewhere else. We know that individuals may have traveled to other places to get that first dose. And so it is important for them to know that we are available to provide the second dose of Moderna to them.
From CBS Austin, Yesterday, DSHS said that vaccine hubs across Texas were seeing slowdowns in distribution and that they would honor requests to receive less vaccine. Do you plan to reduce the amount APH receives each week? If not, how will you change your strategy?
We were anticipating that we were going to see a decline. In the conversations that I've had with other health directors across the state of Texas, that is something that they are seeing as well. And so one of the things that is important is that as we had anticipated this, kind of looking at lessons learned from H1N1, providing that vaccine, this is the time that we gradually start to pivot to establish those partnerships where we're doing more with our mobile vaccine team, and then also looking at locations where we are partnering, for example, as I stated earlier, with the Health Alliance for Musicians, and then also an event that we have this weekend happening at Sacred Heart. And so it's important for us to kind of pivot and start down that path where we're working in smaller locations, looking at more of a neighborhood model. And so we will continue to do that. As we know, as Dr. Escott stated earlier, we know that there are 350 providers. And so we're anticipating that if not all of them, most of them are receiving vaccine, and it is more widely available. And so being a safety net provider, the goal is long-term, is that we will decrease the number of vaccines that we are receiving to be able to have the footprint of being the safety net provider once we have more folks that have received the vaccine in Travis County.
This is from KOP Radio. The 1918 flu is said to have mutated over the last century to become the less menacing common flu we face each fall with booster shots. Is this what you expect to happen with COVID-19?
I certainly anticipate that completely ridding the world of COVID-19 is going to be nearly impossible. It's a very difficult task because it is such a widespread disease right now with multiple variants already present. We are seeing significant variations in the vaccination rates across the world. The U.S. is doing very well as compared to many other countries. But I think that poses a challenge for us to eliminate COVID-19. I think the most likely scenario at this stage is that we will need a seasonal booster for COVID-19. Again, when we think about flu, we have some pre-existing immunity from flu every year. There's some subtle variations that happen in typical years. We assess what's happening in the Southern Hemisphere, in the flu season in the Southern Hemisphere, and then we create the vaccine for the Northern Hemisphere. I imagine that we will see a similar pattern for COVID-19, and that annual booster will take the dominant strains and create that booster shot to boost the immunity for COVID-19. Of course, we still have the threat of a new variant emerging which eludes those vaccination efforts. Again, we all need to be careful. I think the best thing that we can do right now to avoid that long-term perpetual issue with COVID-19 is to do two things. Number one, get vaccinated. Number two, continue the protections, the masking, the distancing, the hand hygiene, the staying home if you're sick. The more we can reduce transmission right now, the more we reduce the chance of new variants spreading and evading vaccination efforts. So again, we got to vaccinate ourselves, and then we have to vaccinate the rest of the world. So part of our overall strategy as a community, as a country, has to be immediately transitioning from herd immunity in the United States to herd immunity across the globe.
This question is from KUT. You've talked about pivoting vaccine efforts to meet people where they are. How quickly can you make that transition?
We can make that, we have already made that transition. Over the last couple of months, we have piloted several events. We have been at churches, we have been working at the housing authority, in their community rooms, etc. This weekend, we're going to be at Sacred Heart. This morning, we are going to be working with HAM. And so that has always been in our plans. And so the goal is to start doing more of those type of events where we are able to do those every Saturday. And so we're definitely on that path to do more.
Last question in this first round of questions is from Fox. What will happen to the surplus of unused vaccine doses?
We typically use all of our vaccine. And so our goal is not to waste any vaccine. So typically as providers, you account for how much vaccine you have and keep an inventory. That inventory is sent back to the state, and so they're able to account for how much vaccine you have. And so it's important for us as we are planning our efforts and scheduling appointments that we have the ability to scale up and do more at events that we have scheduled in the weekend. So it's important for us to stay on top of our inventory and always know that we are not wasting any vaccine. Worst case scenario, all of the partners, including Austin Public Health, we have the ability to transfer vaccines to our other partners that have been approved by the state of Texas to provide vaccines. And so we always keep that in mind if that is an option that we need to use.
Okay, next question is from Community Impact. As a hub provider, is it possible for APH to reallocate some of its mass vaccination site doses to outreach programs like the mobile vaccine unit? Does the requirement to make your doses available to statewide residents complicate efforts to shift focus to community-based outreach?
We have done that this entire time. One of the things that as a hub, it is essential for you to be able to provide those vaccines statewide, have a system where folks can access those vaccines. But what we have been able to do is to allocate vaccines to our mobile team. We have also been able to work with our pilots to allocate vaccine that way. And we've also been able to put vaccine aside to schedule appointments into existing clinics where folks don't have access to the internet, have not been able to access our portal through our equity line. And so that team is making outbound calls to individuals from that allocation that we receive. And so we will continue to do that. But being a hub, it does allow us to continue the requirement that the state does have in place, but also adhere to being a safety net provider. In addition to that, some of our other locations outside of the hub do continue to receive vaccine. For example, our refugee clinic receives a small allocation, as well as our adult shot clinic receives a small allocation. And so we are able to continue to be a safety net through that method.
KXAN asks, what percentage of new coronavirus cases in Austin-Travis County have been linked to variants versus the original strain? Will this impact the decision to move from stage 3 risk level to stage 2?
So I'm happy to take that one. As you may be aware, there is not a comprehensive genomic surveillance process in the state of Texas. There are some tests which are sequenced. We were looking at opportunities for increasing the genomic surveillance within our system and across the state as well. But we are seeing that the UK variant seems to be the dominant strain in the genomic surveillance that's being done. We have seen one case of the Brazilian variant, and we're certainly concerned about the growing impact of those variants. We're particularly concerned about the potential for the South African variant, which is more successful at evading the vaccine. So again, another reason why the ongoing protections, the ongoing mask mandate locally is important to avoid, in particular, that South African variant, but as the other variants as well. I don't anticipate it's going to impact our transition point. We are in the process of reevaluating the transition points for the stages of risk due to the vaccination efforts to see if that may impact the thresholds for transition. But the variants themselves, we don't anticipate will impact the stages itself.
And I'll add that, again, you know, part of the challenge is there's so many variety of testing options out there. Rapid testing may not be a good way to, especially if they're doing antigen testing, it may not be easily sequenced or whatnot. But we are doing, especially in evaluating breakthrough cases, looking at cases that were vaccinated, or cases who have had a history of COVID. We're trying to send some of that information onto the state lab and to other laboratories to see if we can see if, you know, breakthrough cases in vaccinated individuals are the result of variant strains that may be circulating in the community. As I mentioned before, this is a very good reminder, and Dr. Escott mentioned this as well, why it's important to continue using prevention measures, especially if we have an influx of visitors coming in from various parts of the world or the United States, where variant strains may be predominant, like California or Florida or different places where they have a high prevalence of variant strains. The possibility of it being introduced into our community, or if it isn't already in our community, is very high. So we want to keep those transmission risks from those variant strains down. So it's really important to maintain the masking and social distancing if you're out and about in the community.
The Austin American Statesman asks, can you please describe the demand for vaccines through APH in the past few days, and also provide an update on how many vaccine appointments have yet to be booked?
So we have been evolving our vaccine scheduling process to make sure that as we have clinic appointments available, that we continue to push those clinic appointments out to the public. This week we've opened the scheduler multiple evenings just to make sure that there are ample opportunities for individuals to get vaccinated and to schedule that vaccine. We have had some gap in the uptake of vaccine demand for appointments scheduled that we tried to schedule last night. And we are working to try to fill those appointments to make sure that, again, we are able to offer vaccine to all individuals that are looking for that. Again, noting that that is an indicator. There's additional ways we need to try to open the vaccine scheduler up more broadly to ensure that folks are able to schedule whenever they go online to look for a vaccine. We are looking at those options. And so in anticipation of that, we want to encourage everyone to register for vaccine. If you've not registered already, to register for vaccine. If you already are registered for vaccine, to be constantly looking to see, because we know we have been changing our scheduling options and providing more and more opportunities for those to schedule. So just be vigilant, be looking for those options to expand, because we do anticipate that that will be something we'll be offering in the near future.
CBS Austin asks, do Austin fire stations think they can comfortably handle being ongoing locations for vaccine distribution, as was suggested by Austin City Council members? And what is the reaction APH is getting from apartment complexes about being temporary or one-time distribution? Sorry, I gotta go to the next line. Temporary or one-time distribution points.
In our conversations with Chief Baker, he has definitely been a true partner in this space. Early on, he talked with us about the ability for the fire stations to be able to help us with the vaccine distribution. We told him at that time we really needed to be able to provide quite a bit of vaccine out in a short period of time. And so the conversations to be able to pivot, to be able to use fire stations are plans that we would develop, and looking at locations in the Eastern Crescent to be able to augment what we will currently be doing in our various locations. One of the things we know is important that we've established quite a few relationships and will continue to establish other relationships with apartment complexes. Individuals are very excited to partner with us. They know that being able to market to their residents that Austin Public Health will be there and what time we will be there providing the services is definitely an advantage for an apartment complex to partner with us. And so we are looking forward to being able to identify places that we've gone to in the past to provide various services to, and looking at how we can be in that space to provide vaccines. And so we, like I said earlier, we're very excited about the opportunity to partner in non-traditional spaces.
And I just want to add in, as we have been rolling out more of a mobile strategy throughout the entire vaccine response, there have been partnerships that we've already leveraged with, for example, the Housing Authority to work in multiple residential complexes to provide vaccine, and particularly for those complexes that are housing for older adults. So we definitely have a model that we are prepared to roll out and hopefully be able to expand to other types of residential living facilities. And so I think that's an opportunity that we really are looking to leverage and to ensure that we can extend vaccine to really meet folks where they're at, and provide vaccine and ensure that there's no barriers for anyone who's seeking a vaccine.
Let me just add on one thing about the fire and EMS stations. So I think some people wonder, why fire and EMS stations? And the answer is, for East Austin in particular, that part of town lacks the healthcare infrastructure that exists in other parts of town. When I leave my neighborhood, at the corner, there's an HEB, a CVS, a Walgreens, a Randall's, an urgent care, and a freestanding ER, all in one intersection. That is not the case in East Austin. That is not the case in rural parts of our county. Because of those differences, it is part of the reason why we have trouble distributing vaccine and why we have trouble providing health care effectively in some parts of our city, in some parts of our county. So the fire and EMS stations, however, are present in those communities. There are vaccinators on those fire apparatus, in those ambulances, and it's an easy partnership that is conveniently located for many people across our community. So our hope is that over the next couple of weeks, that we can build those plans out and transition some vaccine to those sites to better provide for folks in our Eastern Crescent and our rural parts of the county.
Okay, from KOP, Considering resistance, indifference, and inequity regarding the vaccine rollout in the U.S. and globally, and given the amount of traffic between Austin, Travis County, and other places, is reaching herd immunity through vaccinations a real prospect for residents?
You know, again, it's going to be a challenge for us. We can certainly reach herd immunity here. Looking at some of the surveys, national surveys about vaccine hesitancy, Austin and Travis County perform better than anywhere else in the state of Texas, with 85% of respondents indicating their desire to be vaccinated. So I think that it's going to be easier for us to get there than other people. But there's quite a bit of variation even across our area. When we look at Bastrop and Caldwell County, vaccination rates are lower. They're lower in other parts of Texas, and certainly they are much, much lower in many other parts of the world, with most of the European Union about half of the vaccination rate of the United States right now. It's going to be a long-term effort to reach herd immunity. Again, the goal of herd immunity is really to have enough people vaccinated where there is not sustained outbreaks, where we can track every case back to where it came from. That's how we have controlled transmission, limited transmission of disease. So we can have some protection here locally across the U.S., across the state of Texas, when we reach herd immunity. But real herd immunity requires global herd immunity, and that's what's going to be a more difficult task to achieve.
Okay, and it looks like the last question is from Fox 7. Is there concern that we have plateaued on vaccinations and people are no longer interested in receiving it? How will that affect the goal of herd immunity, excuse me?
I don't think we have an issue of people not wanting the vaccine. I think we've reached that stage where supply and demand are in equilibrium, and that's okay. We still have people signing up. We still have lots and lots of people every week who are creating accounts and signing up to get vaccinated. So this was, again, anticipated. We expect that we are going to have a stage where it becomes more difficult to get people in the queue, to get them signed up for vaccination efforts, which is why part of the APH strategy all along has been to ramp up those efforts at outreach in transition from a passive model of vaccination to an active model. So actively recruiting people, going out to community centers, to religious groups, to neighborhoods, making it easier and more convenient for people to be vaccinated. So this is an evolving process of vaccinating folks, and I think we're still at a very good stage right now in terms of the vaccine demand. But again, we're going to continue to tweak and modify those operations until we get every last person vaccinated who wants it.
Thank you, Tori.
Thank you, everybody. Yep, you're welcome.
Now we will move into our closing remarks. Stephanie, over to you.
We are very excited about our partnerships, and as we continue to provide vaccines in our community, our goal is really to be able to meet people where they are. And so the mobile vaccine team, as well as the rest of our staff, are going to continue to work with our partners to strategize, always looking to be flexible, because one of the things that we know is that as we move along and there continues to be more vaccine available, we want to be able to meet people and be in the places that they can easily access. And so as we continue to transition our plan, it is going to be so important for us to communicate that with the public. But we are looking very excited to our existing partnerships, but we're also looking forward to new partnerships that we are in the process of developing to be in non-traditional places to provide vaccines. At this time, I'll transition over to Dr. Escott. Thank you.
Thank you, Stephanie. And again, we are seeing increases in cases, 25% increase over last week in terms of our moving average of new cases. We're seeing increases in hospitalizations. We're still waiting on the final numbers for today, but it appears that our admissions to a hospital for today may be 30. And that's almost double the moving average of new admissions to a hospital. Again, it's not a surge yet, but it gives us concern that there is still efficient transmission of disease in our community. So that's why we've renewed the health authority rules, which extend the mask mandate and other protections in public places until May 18th. So it is critical for us to continue those protections, continue to mask, continue to distance, continue to wash our hands, and stay home when we're sick in order for us to drive down disease and buy us more time to get more people vaccinated. With that, I will transition over to Janet Pichette.
Thanks. And as Dr. Escott mentioned, we are seeing this oscillation in the number of cases we're seeing on a daily basis. And as epidemiologists, we continue to monitor that very closely. And I think it just serves, again, as a good reminder that as vaccine becomes available to those that are over the age of 18, especially with the Moderna, or 16 if it's Pfizer, that there's still the possibility, a very high possibility, that you're going to see increased transmission risk in those that young adults who have not received vaccine, or those children who have not been vaccinated. We're seeing it as evidenced by increased numbers in school populations, especially those related to school athletics. We as epidemiologists continue to do our case investigation and contact tracing, and I would ask that we get full cooperation from individuals who are contacted by Austin Public Health or our partner contact tracers at Dell Medical to continue to provide information on contacts and exposures, so we don't get to a spot where we're out of control again, like we were back in June or back in the November timeframe. So it's, again, very important that you cooperate with those case investigators to provide information so that we can squash transmission risks within the community and get people into proper quarantine and isolation. Our isolation facility is still operating if you need a place to isolate from illness. And again, we continue to look at trends in disease and hope that they remain relatively flat and not on the increase, or to the point where we're not seeing a surge again. So again, as I've said through the last year, make sure you're wearing your masks, socially distancing, washing your hands, avoid touching your face. And if you're ill, even if you have mild symptoms that are similar to allergies, please be sure to stay home so that you're not spreading illness. And I hope everybody has a great weekend. Cassie, I think you're on mute.
It's not working.
Cassie, you're muted.
Okay, it seems like Cassie's having some technical difficulties at this time. That concludes our media availability for today. Thank you to APH Director Stephanie Hayden Howard, Dr. Mark Escott, Chief Epidemiologist Janet Pichette, and Cassandra No Microphone De Leon, APH Assistant Director, Disease Prevention, Health Promotion Division, and to our pool reporter, Tori Larnd from KView. Thanks for joining us, and have a safe weekend.
Can definitely feel for Cassie De Leon there, because we have all dealt with technical issues during this year when we've gone to so many virtual operations. That concludes, however, the briefing this week from Austin Public Health, highlighting two things that they wanted to raise today: that there's been a 25% increase in new cases, at least the moving, rolling average of that, and a 10% increase in new hospital admissions since last week. They may have even at least 30 today. There will be new numbers coming out about that, but Dr. Mark Escott saying that another 30 people may have been hospitalized after getting COVID-19 in our area. They also highlighted the fact that there is still appointments that are open right now from Austin Public Health for people to get the COVID-19 vaccine. They have been providing the Moderna shots for people that want it. So if you do and would like to be vaccinated, they're encouraging a lot of people to do that. You can sign up online for the wait list. You can also contact 311 to book an appointment. They will have people there to help you with that. But they also say that because there are openings that are not getting filled as fast as possible, that they've reached that kind of equilibrium where supply of vaccine is meeting the demand to receive it. That's why they're going to shift some of their operations. Today they mentioned that the Health Alliance for Austin Musicians, HAM, is going to have vaccinations offered to musicians in our area. They are looking at potentially opening up fire stations and EMS stations in the community to be a place where people can go to meet and get that COVID-19 shot. They also said that they'll maybe go into apartment complexes. That might be a part of their shifting strategy as they want to go and meet people where they are, as they argue. So we are covering all of this. They wanted to mention that the variants are still present in our community, predominantly the one from the United Kingdom. There's also been one case of the Brazilian variant, and they're also watching to see if the South African variant shows up because, as Dr. Escott pointed out, that has shown that it kind of evades the vaccine, which is not great for us. So they're asking people to continue to wear their masks, socially distance, wash their hands, stay home if you're sick, to try to avoid the spread of COVID-19 and from those variants taking more of a hold in our community. We will have more information about this briefing on our website. That's kxan.com, of course, and on the news app, so please download it. There have been some upgrades made to the app, so check those out too. We thank you all for watching again. I'm Will Dupree here in the KXAN Live studio. We'll see you back here at another time. Please, everyone, stay safe, be healthy, and take care out there.